Puberty. It's a hard topic to talk about. It's a time in a boy or girl's life where they change on the inside and the outside. Today I will be talking about the development of secondary sex characteristics and somatic growth, along with the emotion changes, menstruation for girls, erections and wet dreams for boys, and the changes that you may feel in your emotions. The changes in your hormone system is what causes puberty to occur, so before you even see any signs of physical changes or anything inside of you, a lot of things are happening. Girls have hormones in their body that target their ovaries, which contain the eggs. The hormones then cause the ovaries to start making estrogen. This is a different type of hormone. Together, these two different hormones start to prepare a body for menstruation and then to later have babies. Boys have hormones in their body that travel and tell your testes, which are the two egg-shaped glands in your scrotum, to begin making testosterone and sperm. The first of many changes is the development of secondary sex characteristics. This means the growing of pubic hair, body hair, your genitals, and breast development if you're a girl. The second set of changes is called somatic growth. This is the changes in size, shape, and the composition of your body. However, hormonal changes begin to take place in your body several years before there are any signs of physical maturation. First, I will be talking about the secondary sex characteristics of boys and girls. So first, girls, typically around the ages of 9 or 10, breast growth will appear. 6 months later, pubic hair will start to appear. And then 1.5 years after the development of breasts, the onset of menstruation will occur. I will talk about menstruation and your cycle in a later time in the video. Usually for girls, the puberty length is 3 to 3.5 years, but for some it could be up to 5 or 6. Now on to boys. So boys usually start puberty 1.5 years later than girls, so probably around 12 to 13 years old. Around 11 to 12 years old, the testicular growth, which is the increase in penis size, will start to occur. Then a growth spurt is 3 months later, and then there's the appearance of pubic hair. A peak growth spurt for boys is typically around 13 to 14 years old, and it corresponds with seminarche, which is your first ejaculation. And also other things that can occur for the deepening of the voice, which happens around 14 or 15, the growth of facial hair, which starts about the upper lip, then it goes onto the cheeks, and then it makes its way to the chin and the neck. Now on to an overview of somatic growth. So typically in your adolescence, height gain and weight gain are both one of the major things that a lot of people see. So you'll have multiple growth spurts over a 2 to 3 year period rather than a single grammatic one. But boys and girls both differ. Girls usually gain 3.5 inches of height per year around age 12, and boys do 4 inches per year around age 14. So they're a little bit below us, like I had mentioned before. Girls usually gain 18.26 pounds per year around age 12 as well. And at the end of puberty, girls have usually gained about 24 pounds. And then also for boys, they gain about 19.8 pounds per year beginning at age 14. And before puberty, boys and girls have these similar fat and muscle tissue ratios. But during puberty, girls increase in fat tissue in the breast, abdomen, and hips particularly. Because this increase of fat and its correlation with the start of menstruation, it's believed that a certain amount of body fat is needed for the onset of your period to happen and maintain. So that's why, say a girl weighs 100 pounds in 5th grade and another girl weighs only 80, the girl who weighs 100 pounds will most likely start her period first because she weighs more and her fat has distributed in her body like it needs to. Now for boys, you will gain bone and muscle tissue while losing fat. You will also be developing larger hearts, larger lungs, higher heart rates, greater capacity for carrying oxygen, and higher systolic blood pressure. This is when you start to become more athletic, gain more muscle, get more broader shoulders. You change into a more athletic type body and less of your baby fat. There are a number of influential factors that can affect your puberty. So these factors such as genetics, nutrition, your health and well-being, metabolism, your gender, ethnicity, your hormone levels, your stress levels, and your family constellations can influence if you are faster at moving through puberty, start first, or slower, start later. Not one of them just affects how you go through puberty. It's a combination of a couple of them. It's not just one specifically. So if you are a different ethnicity, that's not going to be the rather reason why you start puberty later. It's going to be your gender and your ethnicity and your genetics. It's not going to be just one. Everyone reacts to puberty and the changes that happen in their body in their own way. If you're watching this video, you're probably around 8 to 15 years old, give or take a couple years. You're probably going through puberty, have gone through puberty a little bit, or have not gone at all. I'm sure you have lots of questions, lots of concerns. You're probably nervous, you're anxious, you're confused. That is totally understandable. There is no right or wrong way to feel about going through puberty. Girls who mature early have the most difficulty with adjusting to puberty because they have the absence of the cognitive, social, and emotional changes that also come with the physical changes. So because of this, they'll probably have higher levels of distress and be less satisfied with their height and weight and have a poor body image and might even have eating problems because they're not happy about the weight they are gaining in their stomach, hips, thighs, all those places that tend to get larger with puberty. Early maturing males are more likely to have hostile feelings toward others, more anxiety, and also engage in more risky behavior. They're also more likely to have sexual desires and engage in sexual activity, and that is due to their hormones changing. This is not true for all children. Like in all things that happen, everyone is different. You could be early maturing or late maturing and have no problems with it. You could be a normal rate of maturing and still not be comfortable and have all these difficulties. It just depends on the type of person. The first visible changes to look out for if you are a girl is body hair, such as your armpits or your pubic area, and breast development. And then if you are a boy, the first changes to look for are pubic hair growth and penis growth. Next, I am going to be talking about menstruation or your period. So girls, listen up. So menstruation can be a confusing time in your life. You may not know what it means, what all happens. You may be confused and you may be really anxious to get it because other girls have. But like I said, most young girls and even boys have no idea what happens or what it means. So about 6 months before you start your first period, girls may notice an increased amount of vaginal discharge. This is just a clear substance that comes out, and probably you will notice it when you go to the restroom, or you may see it on your underwear. There's no need to worry about it unless it has a strong odor or it causes itchiness and an uncomfortable feeling. So your start of your period is your menarche, which doesn't happen until all parts of your reproductive system have matured and worked together. So there's no specific age you can start. I know girls who have started when they were in 5th grade, when they were in 8th grade. There is a big time difference. It's just when your body is ready and complete. So girls, in your reproductive system you have 2 ovaries, fallopian tubes, and a uterus. Look at this diagram to see exactly where the placements are. Ovaries contain thousands of eggs, and then the fallopian tubes stretch from your ovary to your uterus. So about once a month, which is how often you will get your period, an egg leaves the ovaries, which is called ovulation. It travels down the fallopian tubes and toward the uterus. Days before ovulation occurs, estrogen, which is a hormone in women, stimulates the uterus to build up its lining with tissue and blood. This is to prepare the uterus for pregnancy. So if an egg is fertilized, meaning you get pregnant, the sperm cell which impregnates you will travel down the uterus and attaches to the walls of the uterus where the baby will develop. If the egg is not fertilized, which happens most of the time, the uterus sheds the extra tissue in the lining that had built up preparing for the pregnancy. So the blood, the tissue, and the unfertilized egg leave your body going through the vagina and out of the body. That is your period. That is what happens once a month unless you are pregnant. So this happens every month until women reach menopause, which is they no longer release eggs. That happens in your late 40s, early 50s, so you don't have to worry about that for a very long time. Even though I said that this menstrual cycle happens once a month, irregular periods are common in those who are just starting out. So it's okay if you miss a month here or there, and after about a year or 2, it becomes more regular. And the amount of time that you are on your period will vary. So some girls last 2 to 3 days, meaning they are bleeding, they are releasing the blood, tissue, and unfertilized egg for 2 to 3 days, while some girls can last up to 7. It may come as a shock to you to see all of the blood, but in reality, it's only about 2 tablespoons for your entire period. Most girls will also experience physical pain and emotional pain around the time of their period. The most common is cramps. These are caused by the contractions in your uterus to release all of that stuff from your body. The amount of pain that comes from your cramps varies person to person. They can be in your lower abdomen or even in your back. They can be severe to very minimal. It just depends on the type of girl. Some girls may feel sad or irritable during the first few days or weeks before their period. Some even get cravings. This is a result of the premenstrual syndrome, or most commonly known as PMS. Also related to the changes in your hormones, you can also feel bloated, have sore breasts, and even get headaches. This goes away when your period begins, but it most likely will come back every month. Acne flare-ups are also common during your period because of the changing in hormones. And now you may be wondering what to do with a blood and how to discard of it. Most girls use pads or tampons. It depends on what you like and what stage you're at. Starting out, most girls tend to use pads. It is a lining that goes in the bottom of your underwear. You need to change it every couple hours depending on how heavy your period may be. Like I had said before, this is what a pad looks like. It is just a pad that goes in the bottom of your underwear. There's a sticky part on the bottom, so you just stick it to your underwear, flatten it down so that it stays, and pull your underwear up, and then change it whenever you decide it's necessary. And when you get more comfortable, you can use tampons, which go inside of your vagina. They need to be changed more often, probably around every 2 to 3 hours, depending on your flow. I have included a diagram of a tampon in a later section of the video, but this is what it looks like. The diagram was a little blurry, so I just wanted to make sure you got what it looked like. You push this end, and this part comes out, and this is the part that goes inside of you. Now it's time for the boys to listen up. You won't have such an extravagant event like menstruation in girls, but you will have things called erections and wet dreams. An erection is when your penis fills with blood and it hardens. It will become larger and stand out from your body. These will start to occur more frequently after you hit puberty. Then they can happen at any time. Sometimes they might happen while you're sleeping, and you can wake up and realize your underwear or bed may be wet. This means that you have nocturnal emission or have had a wet dream. A wet dream is when semen is discharged through the urethra, which is the same part that urine comes from, and that is called an ejaculation. Wet dreams occur when the body starts making more testosterone. Testosterone is the hormone in boys such as estrogen is in girls. It is preparing your body for a future when you decide you may want to have children. Semen contains the sperm that can fertilize a woman. Can't help it, so don't feel embarrassed about having wet dreams. All boys experience this during their puberty. Along with all the physical changes that happen to your body, there are also lots of changes that are happening inside of your mind. You might start to feel strong emotions that you have never felt before. You will probably even start to lose your temper a lot more often, and you might not even know why you are getting so angry. It's okay for this to happen. Your mind is just anxious and trying to catch up with all of the emotions and changes that are happening on the outside of your body as well. Thank you for watching this video that taught you about the changes that are happening inside and outside of your body. Whether they're happening now or will happen in the future, I hope you learned a lot of new information. If you have any real questions or concerns that you feel may not be right about the changes that are happening, please contact your local doctor.